Hi everyone, and welcome to the latest in our series of lockdown video interviews. Now today I'm joined by Professor Lorna Harries. Now Lorna is a Professor of Molecular Genetics here at the University of Exeter Medical School. And much of Lorna's research investigates how and why we age and the reason that age is a major risk factor for lots of common chronic diseases. But right now Lorna's actually developing a new test which could detect whether people who have had COVID-19 are still infectious. So welcome Lorna, thanks so much for joining me.
No problem.
If I could just start by asking, what's the difference between the test that you're developing and a regular COVID-19 swab test?
Sure. So the existing test actually just looks for the presence of viral RNA, but it doesn't actually differentiate between active infectious virus and the fragments that are left after your immune system has dealt with it. So it can pick up the presence of viral fragments whether or not you're infectious.
Okay, and what are you looking for in the test? We keep hearing about antibody tests. Is that what you look for to determine?
No, it's still a test looking at viral RNA, so that the virus is made of RNA. And when it gets activated, it actually has a little rearrangement of its structure to produce something called a subgenomic RNA. And these things are only present when that virus is active and dividing and replicating. So our test looks specifically for those.
Okay, brilliant. And do you think there's a possibility it could work for people who are not yet showing any symptoms of COVID-19?
Yep, absolutely. So it has no, it makes no difference to the test if you're symptomatic or not. If the virus is there and it is dividing and replicating and preparing to give you symptoms, you will still test positive.
Okay, brilliant. And how is the test conducted? Is it a swab test or?
So yeah, so it's actually done from the same material as would be produced from the swab that's going through the routine testing. We can use the same material for that, but because we're looking for slightly different bits of this rearranged virus, that's present in the swab material. So actually we're using the same samples. Once we've finished optimizing it and we're happy with it, it will just be another additional add-on test that we can offer as part of NHS testing.
Oh, brilliant. And so in the long run, could this test help to reduce infection rates then and get people back to work or not?
Yeah, so potentially. So at the moment, the current advice is that if you are showing symptoms that you self-isolate for 7 days, but we don't actually know really whether 7 days is enough. So our test will tell you on average, when we've gathered the data, it will tell you how long on average people are still testing positive for these active fragments. And that might inform government policy if it turns out not to be 7 days. Actually, I think more important for telling us who might not be infectious. So at the moment, healthcare workers, care home returnees have to have negative tests before they are allowed back. And the problem is people can remain positive on the conventional test for 6-7 weeks.
Wow.
We don't think they're infectious. So what our test will be able to provide evidence to get people safely back in their care homes, safely back on the front line quicker.
Brilliant. Now, this research, obviously, like so many other coronavirus research projects, is moving very, very quickly. I mean, what's the process in a research project like this in order to determine effectiveness?
Yeah, sure. So we've actually started off with sort of synthetic virus, if you like. So these are little bits of DNA, they're fragments that are very similar to the virus so that we can optimize our assays. So the first thing that we'll do is we'll look to see how sensitive it is, so how small an amount of virus that you can find. That's looking good, actually. We can detect down to about 10 copies, which is pretty good. We then want to see how reproducible it is. So each sample will be done three times or multiple times, and we look to see how similar those measurements are. At the moment, it's looking above 99%, which is also really good. The next thing we do is we look to see how it behaves in a more complex mixture. So if you've got, say, 1% active virus on a bed of 99% inactive virus, does that look the same as 99% active virus? And yes, it does.
Right.
So that's where we are at the moment. Everything's looking pretty good. The next thing that we will do is we've been banking samples in collaboration with the molecular diagnostics lab and with the microbiology labs here. So they're banking samples for us, and they're going to provide us with a collection of samples who have tested positive with the conventional test, some of which we don't think are infectious and some of them we think they are, and we will test them without knowing who's who. And hopefully we'll be able to pick out the ones that they think are infectious from the ones that aren't. So those are the kind of the usual steps that we use for validation. And then going forward, when we're happy with it, we can roll it out.
Brilliant. What are the long-term plans then for this research project?
So one of the other things that I didn't mention that our assay can do that the conventional test can't, is most of the tests that are done in an NHS setting are really just to have you got the virus or not.
Yeah.
Our test can tell you how much virus. So one of the big unanswered questions at the moment is why some people react very badly to the virus and why some don't. So why some people end up in hospital and why some people are fine sitting out at home. And there are big differences actually in people's mortality chances with age or metabolic disease, for example. But we're actually seeing deaths in people who are young and with no underlying complications who really shouldn't be. And we've got no way at the moment of predicting who they might be. So this is probably multifactorial. There are probably lots of explanations. But one thing that we think is important is how much virus you're carrying. So to me, it's kind of obvious that if you're carrying a little tiny bit of virus, you're going to be better than someone who's got a lot.
Yeah.
So, and now because we're able to measure accurately how much virus or how much active virus somebody is carrying, we're going to use this information together with all the other information that we have about the patients to actually build a mathematical model to see if we can predict how someone might react based on their characteristics and their viral load.
Wow, that sounds really impressive.
Yeah, we're very excited.
Yeah, sounds really good. I mean, thanks so much for joining me today, Lorna. I know you're very busy on the project, so I really appreciate
problem.
you
We're certainly
taking
busy.
some time out. And it sounds really positive, really exciting. We look forward to hearing a bit more.
No problem.